Atrial fibrillation is one of the most common heart rhythm problems, but many people don't realize how serious it can be because even when it feels intermittent or mild, it increases the risk of stroke. Hello, I'm Dr. Joban Sehmi. I am a consultant cardiologist in Hertfordshire. I specialize in all aspects of general cardiology and am a specialist in advanced cardiac imaging. I'm going to explain atrial fibrillation simply and clearly, what it is, why it happens, what risks it carries, and what modern treatment options are available. What is atrial fibrillation? Atrial fibrillation is common, but it is widely misunderstood. A lot of people hear AF and have no idea what it means. Atrial fibrillation, often shortened to AF, is an abnormal heart rhythm. Normally, the heart beats in a regular coordinated pattern because the electrical system sends signals in an orderly way. In atrial fibrillation, the electrical activity in the upper chambers of the heart becomes chaotic. Instead of a smooth rhythm, the upper chambers of the heart, the atria, quiver and the heartbeat becomes irregular and may often become faster. This irregular heart rhythm means the heart may not beat as efficiently as it should. Some people feel this immediately, others barely notice any symptoms, and some find out when it's picked up in a routine test or from a smartwatch alert or a test done for another reason. AF can last for short episodes or can last for much longer and become persistent. In some patients, it becomes a long-term rhythm, so this is not a one-size-fits-all condition. The pattern matters. The reason why AF matters is not just because the heart rhythm is irregular, it is also because blood can pool in the quivering upper chambers of the heart, the atria, and when blood pools, this predisposes to clots. If you're sensing palpitations in your everyday life, this may be the reason. Some people feel a fast, pounding, or fluttering heartbeat. Others notice breathlessness, reduction in exercise tolerance, dizziness and tiredness, or just a sensation that things are not quite right. Some people feel anxious when AF starts because the heart rhythm disturbance can come on suddenly. They may say the heart feels jumpy, erratic, or impossible to ignore. Others feel surprised when a monitor shows AF because they don't experience any symptoms whatsoever. This matters because symptom severity does not always match. Someone with dramatic symptoms may not be at greater stroke risk than someone with silent AF. This is why proper assessment is essential. If symptoms are new, prolonged, or associated with collapse, worsening breathlessness, or significant illness, the rhythm needs careful evaluation. And if someone has intermittent episodes, then it may take ECG monitoring or a wearable device to come to an accurate diagnosis. People often ask, why did this happen to me? Often there's a clear reason. Sometimes this heart symptom appears in people who think they're completely fine. Atrial fibrillation becomes more common in older age, but it does affect younger individuals as well. It is associated with high blood pressure, valve disease, thyroid problems, diabetes, obesity, sleep apnea, alcohol excess, and other heart conditions. Stress, infection, illness, and surgery can also trigger it. In some people, AF can develop because the upper chambers of the heart become stretched or irritated over time. In others, it reflects a wider pattern of cardiovascular risk that has been building up quietly over several years. There are also lifestyle triggers. Alcohol is a big one. Poor sleep can matter. Stimulants can matter. Sometimes people notice episodes after illness, dehydration, or extreme stress. And still, some people do not have an obvious cause. That can feel frustrating, but this is not unusual. The job then is not just to confirm the underlying rhythm, but to identify and treat the factors that may be helping it persist. The biggest danger of this heart problem is not always what people think. A lot of patients focus on the irregular heartbeat, but the long-term risk we worry most about is stroke. Atrial fibrillation increases the risk of stroke because blood can pool and stagnate in the upper chambers of the heart, and in particular in an area called the left atrial appendage. Atrial fibrillation increases the risk of stroke because blood can stagnate and form clots in the upper chambers of the heart, and in particular in an area called the left atrial appendage. If a clot travels from the heart to the brain, then this can lead to a stroke. This is why AF deserves serious attention even if symptoms are mild. AF can lead to fatigue, exercise intolerance, and worsening quality of life. And in some cases, a weakening heart muscle, particularly if the rate remains uncontrolled for a long period of time. It may aggravate other heart conditions and make people feel dramatically worse. However, the risk is not identical for every person. We estimate risk of stroke using specific clinical factors, including your age, the presence of heart failure, whether you have hypertension, whether you have diabetes, if you've had previous stroke, if you had previous heart attacks or operations on the heart or the blood vessels of the rest of the body. We also factor in your gender, so we know that strokes are more common in females than males, and this also increases your risk. Using these factors, we're able able to give you a score. We give a score out of 9. If you score 2 and above, then this indicates that you are at increased risk of stroke, and this guides whether a blood thinner is required or not. Clinical factors are important to decide if a patient requires blood thinners or not. We use a specific score. It's called a CHADS-VASc score. This is an algorithm that is based on your age, whether you have heart failure, whether you have high blood pressure, whether you're diabetic, your gender, if you've had a previous stroke, if you've had a heart attack or previous operations on the heart or the blood vessels of the rest of the body. We can use this score to generate an individualized score for each individual. The maximum score is 9. If you score 2 or more, then we know that you're at increased risk of stroke, and in these individuals, a blood thinner is highly recommended. Of course, we take into consideration whether a blood thinner may increase your risk of bleeding, and we factor this into our final decision. The risk of stroke associated with AF is not often obvious, and this can often lead to confusion. Patients often think that when their heart rhythm slows down or indeed reverts to normal, that they're safe. It doesn't matter if AF comes and goes or AF is there all the time. What matters is your risk of stroke, depending on several clinical factors. Just because your symptoms are improved or better doesn't mean your stroke risk is reduced. Therefore, it's important that you're assessed. It's critically important a clinician accurately evaluates your stroke risk and advises on blood thinners accordingly. The diagnosis of atrial fibrillation must be confirmed with an ECG. If the symptoms come and go, longer monitoring may be required, such as using a Holter monitor or other ambulatory testing. This helps capture intermittent AF that may be missed on a shorter recording. We also do blood tests. We check renal function, assess how well your thyroid is working, and look for related triggers or contributing factors. An echocardiogram is always useful because it shows the structure of the heart, including valve disease, chamber size, and how well the heart is functioning. This broader assessment matters because AF is not just a rhythm label, it is often part of a bigger story. Are there other structural problems? Is there heart valve disease? Is there untreated sleep apnea? Is the heart muscle strong? Is the stroke risk good? AF management starts with getting the whole picture, not just documenting an irregular heart rhythm. Treatment for atrial fibrillation is not just stopping the irregular heartbeat. Treatment usually focuses on 3 main goals. First, reducing stroke risk. Second, controlling heart rate or restoring rhythm, addressing the triggers and the wider cardiovascular issues that led to AF in the first place. To reduce stroke risk, some patients need anticoagulant medications. To reduce stroke risk, some patients may need anticoagulant medications, and these are blood thinners. There are 2 main types of blood thinners. The older medication is warfarin. This is sometimes known as rat poison, but this is not an appropriate term. This is a very effective medication that has been used for several years to mitigate stroke risk. The problems with warfarin are that it requires close monitoring, so it's important to check. You often require blood tests to monitor how thick or thin your blood is, and often multiple dose adjustments are required, particularly when you start warfarin. Warfarin has now largely been superseded by newer medications called DOACs, which stands for direct oral anticoagulants. These medications effectively thin the blood and do not require regular blood tests, and these are often the first-line medications for most patients. To treat symptoms, we have multiple options. These can be broadly categorized as medications that control the heart rate, medications that control the heart rhythm or restore heart rhythm. In some patients where medication is not enough, then we have the ability to restore your rhythm to normal using an electrical impulse that's imparted on the heart, and this is called cardioversion. For symptoms, we have a multitude of options, and we decide on what treatment is appropriate for a patient based on their own personal preference, their age, and their other comorbidities or other medical issues. Broadly speaking, treatments can be categorized as medications that control the heart rate or medications that restore the heart rhythm. When these medications are ineffective or patients continue to have symptoms, then other options are available. The 2 main options available are cardioversion and catheter ablation. Firstly, cardioversion. What this refers to is imparting an electrical impulse on the heart to reset the heart rhythm. This is done under a general anesthetic and takes a few seconds or minutes to do. I appreciate this sounds quite drastic, but let me reassure you that this is a very safe and effective way of restoring normal heart rhythm. In other patients who do not respond well to tablets, or indeed young patients who want a more long-lasting cure, it is possible to put a tube inside the heart on the leg and map out the heart's electrical circuitry. It is possible to identify a short circuit in the heart that is triggering atrial fibrillation and remove it completely by either freezing this area or by burning it away. This is a very safe procedure. It's a very effective procedure and is a method that allows us to maintain a normal heart rhythm rhythm for longer. In parallel to medical interventions or procedures on the heart, lifestyle really matters. Important factors include maintaining a healthy weight, minimizing alcohol intake or certainly drinking alcohol responsibly, good sleep hygiene, treatment of sleep apnea if this is present, controlling diabetes, if there's issues with your thyroid, getting on top of that. All these factors are really important and can mitigate the risk of future episodes of atrial fibrillation. The key message is that AF is common, important, and very treatable. The key message is AF is common, important, and treatable. It should not be dismissed, but it should not be viewed as hopeless. With proper assessment and treatment, most patients lead a good quality of life and significantly reduce their risk. Thanks for watching. Please subscribe to this channel for more educational content. To book a consultation call with me, please go to the link in my bio.